One of the things that kind of struck me when I was going through the education to become a certified nurse midwife was that I realized that in the medical field, we have primary care doctors that we go to for pretty much all of our care. And if something's wrong, the primary care doctor refers us to a specialist. They refer us to an oncologist if we have cancer, or a cardiovascular doctor if we have, clotting disorders, or, whatever, a psychiatrist if we have mental health issues. That's not what happens in the field of childbirth. In the field of childbirth, you're automatically assigned to a specialist. You're automatically assigned to a surgeon, okay? Because that's what OBGYNs are. They're not trained in natural normal births. They get like something like 5% of their training is in natural births, and then the majority of their training is in worst case scenarios. It's like, so sending a woman to to a specialist right out the gate when there's nothing wrong with her really doesn't make any sense. What really makes sense is to send them to the primary care provider, like a nurse midwife out the gate, where 90% of our education is tailored towards natural healthy births. And then as professionals, as primary care providers, if there's a problem, and if, of course, like you said, we will recognize it and then refer them if necessary. And that's how every other spectrum of the medical field is run. But for some reason, not in midwifery.
And the inability for midwives to safely come into these hospital settings and practice at the fullest ability of our scope, I think, is what's hindering things. Well, they're actually saying that midwives improve outcomes. The CMQCC specifically said that risks are lower, postpartum hemorrhage lower, preterm birth lower, things like recognition of shoulder dystocia, cesarean rates all lower when we have midwifery care integrated into these systems.